very happy to see this pass. It's definitely a step forward. Okay.
Health insurance companies will now be under the microscope. The state strengthened rules on how companies make sure their networks are adequate. Good evening, I'm Jessica Coons. Brandon is on assignment. These rules allow the state to better enforce laws that have been on the books for nearly 6 years. The changes come after our Target 3 investigation found Blue Cross Blue Shield of Illinois was inflating its provider directories. Our Capitol Bureau Chief Cole Hankey live in our Capitol newsroom tonight. And Cole, experts are saying these rule changes can lead to some real change for people.
Yeah, they're saying these rule changes can provide a real lasting impact for patients across Illinois, as well as keep insurance companies accountable. Health insurance companies will see increased scrutiny going forward after the state passed new rules around how they deem a network adequate. The state passed the Network Adequacy and Transparency Act in 2017, but the groups that fought for that law say the way the Department of Insurance enforced it was too lax. Now, years later, the law may finally have some teeth.
I feel like, taking on insurance companies is like taking on the elephant in the living room. And how do you eat an elephant? One bite at a time.
The new rules come in response to a WCIA Target 3 investigation into Blue Cross Blue Shield of Illinois. The new rules require health insurance companies to regularly update their directories, both with provider information and proper distances listed for those providers. Our investigation found Blue Cross Blue Shield's directory listed doctors who didn't even practice in the state of Illinois anymore. The Illinois State Medical Society fought for these rule changes for years. In a statement, the organization's president-elect called it a big win for patients of Illinois. But he also said it's on the state to follow through, saying, quote, "We urge DOI to fully enforce this law and to continue to hold insurance companies accountable to provide the health care they have promised patients." The new rules require health insurance companies to audit their own networks multiple times per year and report those findings to the state.
So yeah, I think force them to do an audit every 90 days of their directory to update it is helpful. I'm still going to point out, if you have lazy bureaucrats that don't check the self-certifications, none of this is going to matter.
The rules also increase transparency around when and how networks report major changes to their plans, such as Blue Cross Blue Shield of Illinois dropping Springfield Clinic out of their network. Now, another part of these rules is that the Department of Insurance is actually making a completely new committee, and that committee's sole job is going to be to review audits that the health insurance companies from across the state submit to the Department of Insurance. Reporting in Springfield, I'm Cole Hankey, WCIA 3, your local news leader.
Cole, thank you. We asked Blue Cross Blue Shield of Illinois for comment on the increased scrutiny health insurance companies will see going forward. A spokesperson said in a statement, quote, "We appreciate the efforts of the Illinois Department of Insurance and the Joint Committee on Administrative Rules to provide more clarity on the requirements associated with the Network Adequacy and Transparency Act."